This is the second part of the disorders of the cardiovascular system. Today we're going to discuss hypertension. What is hypertension? Hypertension is a patient having a blood pressure over 140/90. What to do with a patient with hypertension coming to me in the dental clinic? I have to reduce the stress as much as I can, as stress increases the blood pressure, and this can make the patient face complications like strokes or even cardiac arrest. Treat always under local analgesia with or without sedation, and remember, no epinephrine in the local anesthesia. Antihypertensive drugs are not stopped before general anesthesia. The patient must take his medication even if he's going to do a procedure that requires general anesthesia. Postural hypotension. Postural hypotension is a condition that we see a lot in old patients and in hypertensive patients taking antihypertensive drugs. Why do these patients get postural hypotension? Postural hypotension means that if the patient who is sitting or lying down suddenly stands up, he feels dizzy because of drop in the blood pressure. Normally, when a normal individual stands up from the sitting or the lying position, we get activation of reflexes in the blood vessels of the lower limbs, constricting them, vasoconstriction, and this prevents pooling of the blood to the blood vessels of the lower limb, and so the brain gets its usual amount of blood. We can face this condition of postural hypotension in these two categories of patients: the old patients because of weak reflexes, and the hypertensive patients taking the antihypertensive drugs. When with the dental chair, if I put the patient on the dental chair in the supine position, and this patient is an old patient or a hypertensive patient taking antihypertensive drugs, I have to gradually change the position of the dental chair from the supine position to the semi-sitting and then to the sitting position, and take very good care while the patient is standing out of the dental chair. Syncope or fainting. Fainting is loss of consciousness, and syncope means fainting due to a cardiovascular cause. We have three cardiovascular causes of fainting. Number one, vasovagal. Vasovagal can be precipitated by fear of dental treatment, particularly with hot weather or when the patient is hungry due to lack of food. What happens is reflex bradycardia and peripheral vasodilation. This reduces the blood pressure, reduces the amount of blood reaching the brain, and the patient may faint. This occurs while the patient is standing. Very rarely that it can occur while the patient is sitting or lying down. Treatment is very simple. Just put the patient lying down and raise his legs up. Second type of syncope is respiratory syncope, and this can occur with straining or coughing or urination or any condition that increases the intra-abdominal pressure, which reduces the venous return to the heart, and this leads to reduction of the cardiac output with the reduction of the blood reaching the brain and can lead to fainting. Carotid sinus syndrome. Some patients have a sensitive carotid sinus. Carotid sinus is present in the neck, and with any gentle pressure on the neck will stimulate the carotid reflexes with bradycardia, hypotension, and may reach even into cardiac arrest. This type of syncope, the carotid sinus syndrome, may occur in the supine position. Dyspnea or shortness of breath. This is a sign or a manifestation of heart failure. Whenever I face a patient with dyspnea, I have to ask about the degree of exertion that precipitates the breathlessness. What makes you breathless? I ask this question. Two forms of dyspnea indicate very severe heart failure. The first is paroxysmal nocturnal dyspnea, which is a breathlessness that occurs at night and wakes the patient up from sleep. It's called paroxysmal nocturnal dyspnea. The second type is orthopnea, which is breathlessness on lying flat. The patient cannot lie flat without any cushions. He sometimes puts 4 or 5 cushions behind his back, or he may even incline forwards on a table in order to sleep. He cannot tolerate the lying down position. He will feel suffocated. He cannot tolerate this position. This is called orthopnea. Orthopnea is dyspnea on lying flat in bed. And dyspnea with all the previous types is a sign of left-sided heart failure, which is due to lung congestion. If you remember the circulation, when we have a left-sided heart failure, when the left heart fails, it means that it cannot pump the blood forwards, and the blood is kept behind this failing chamber. In case of left-sided heart failure, the blood is kept in the lungs, and this leads to lung congestion, and the patient complains of dyspnea. What if the right side of the heart fails? The pump will not, or the right heart will not pump the blood forwards to the lungs. It will be kept behind in the tissues, and we get edema. So edema is also a sign of heart failure, but right-sided heart failure. We can look for edema or test for edema according to the condition of the patient. If the patient is bedridden, the edema will be evident in the sacral region at the lower back. So we test for edema in the lower back in the bedridden patient. But if the patient can move, he is ambulant, we search for edema in the ankles, in the area of the ankles. And how to test for edema? By one finger we press, and then for a few seconds, maybe 4 or 5 seconds, and then when we remove the finger, we find a pit, we find a hole or an impression in the skin, which indicates or proves that this patient has edema. Like here, you can see this pit after pressing with the finger. This is how to test for edema. You press by your finger for about 4 or 5 seconds, and then when you remove your finger, you find an impression for a while, and this is called pitting edema. Like here, press for 4 to 5 seconds, remove your finger, and you find a pit or a hole or an impression on the skin that remains for a while and then goes. What is congestive heart failure? Congestive heart failure when both chambers fail, right-sided failure plus left-sided failure. It's a biventricular failure. There's a left-sided failure which gives dyspnea, and right-sided failure which gives edema. And you can search for edema in the ankles or sacral or inside the abdominal cavity, what we call ascites. What is the management of heart failure? If a patient comes to the dental clinic while he is tired because of heart failure, we consider him uncontrolled heart failure. And if the patient has an uncontrolled heart failure, he has to get a treatment to control his heart failure, to stabilize his symptoms. So in uncontrolled cardiac failure, we have to defer the dental treatment until the symptoms stabilize. And we have here 2 advices. If a patient has got a left-sided heart failure, we may have to avoid the supine position to prevent the patient from having dyspnea. And with right-sided heart failure, the dental treatment should be done while the legs are elevated in order to minimize the dependent edema. But take care of orthopnea. Thank you very much.